Hello, how are you all? Hope you are fine and preparing well for AMC Part 1 examination. This is Dr. Zara and we are solving some recalls from the Gynae section. So let's start. A 26-year-old woman comes to you with a cervical screening test result reporting high-grade squamous intraepithelial lesion HSIL. She is 34 weeks pregnant. Which one of the following is the most appropriate management at this stage? A. Loop excision. B. Cone biopsy. C. Continuation of the pregnancy. D. Offer termination of the pregnancy now. E. Refer for colposcopy. So first of all, we will see that what is high-grade squamous intraepithelial lesion. There are two results which we can follow in cervical screening. Either it is high-grade squamous intraepithelial lesion or low-grade squamous intraepithelial lesion or normal cervical screening or normal cytology result. So sometimes in some books it's given high-grade or in form of dyskaryosis if it is given. So moderate or severe dyskaryosis, moderate or severe dyskaryosis, and low grade is mild dyskaryosis. So this should be understandable that this is high grade squamous intraepithelial lesion means moderate and severe dyskaryosis noticed in the cervical screening test result. Okay. And they are asking, the patient is also pregnant and they are asking the appropriate management at this stage. So first of all, I will rule out this offer termination of pregnancy now. Why this is a very wrong statement? Because first of all, she is pregnant and she is 34 weeks pregnant. And second important thing is there is no need to offer termination of pregnancy now. This is not the cancerous stage. Okay, this is the pre-malignant lesion. This high-grade squamous intraepithelial lesion, low-grade squamous intraepithelial lesion, or in other form moderate or severe dyskaryosis, or if low-grade it is we calling it mild dyskaryosis. These all are pre-malignant lesion, as well as if we will perform the biopsy. So SIN1, which is low grade, and SIN2 and SIN3 high grade. Okay, so these all are pre-malignant lesion. These are not the cancerous stage. These are the pre-cancerous or pre-malignant lesion. Okay, this is the pre-malignant lesion. So we will not offer termination of pregnancy now because this is the this is only the showing only in the screening test. It is a high grade squamous intraepithelial lesion. No need to offer termination of pregnancy. Even if she is having cancer and she crosses the weeks, which is 22 weeks, so after 22 weeks we have to continue the pregnancy. Even she is having a stage 1A, if it's stage 1A cancer or 1B cancer, we can continue the pregnancy, but the management or in terms of mode of delivery will be changed. If it is 1B3 cancer, then we have to perform a cesarean section. So these are all the, in that condition in which the lesion is cancerous, or in which they are mentioning that that is invasive cancer. Even if she crossed 22 weeks in the cancerous stage, we will not offer termination of the pregnancy in the cancerous stage. So these all are the separate thing, but here they have mentioned the pre-malignant lesion. Please remember, these are the pre-malignant, SIN1, SIN2 and SIN3. These are not the cancerous, these are the pre-malignant lesion. So offer termination of pregnancy is completely wrong statement. Continuation of the pregnancy, yes, we can continue the pregnancy, but there are some options which is better than this. So continuation of the pregnancy is not for the management. It's just we have to continue the pregnancy, but this is not the appropriate management, because she is having a high grade squamous intraepithelial lesion, we have to perform some investigation to rule out that either it is a cancerous or it is a pre-malignant sin 2 or sin 3. So some appropriate investigation should be done at this stage, because if she is in the investigation, if it's come out that she's having a high grade invasive cancer, then we have to offer a cesarean section at this stage, and we have to deliver the baby, and then post delivery she need chemotherapy and so on. So yes, continuation of the pregnancy is the statement, but high grade squamous intraepithelial lesion is coming here, so we have to perform some investigation here to rule out either it is a cancerous or a pre-malignant. Please understand this. Cone biopsy is completely wrong, because this is the treatment for stage 1A1 cancer, and this is only showing high grade squamous intraepithelial lesion. This is the wrong option, cone biopsy. And loop excision, yes, loop excision we have to perform when we are performing the colposcopy and biopsy, and if it is coming sin 2 or sin 3, so for the sin 2 and sin 3 the treatment is large loop excision of the transformation zone. But here first we have to perform the colposcopy and biopsy to see whether it is pre-malignant, it is invasive cancer, and so that this is loop excision we cannot perform. First we have to perform the colposcopy and biopsy. So we have to perform in this patient, we have to refer this patient for colposcopy. So correct answer is E, refer for colposcopy. Sometimes there are some misunderstanding that we cannot perform colposcopy in pregnancy. It is completely wrong. We can perform colposcopy if it is indicated like this. In this situation, it is indicated here because the cytology result, the cervical screening test result is showing high grade squamous intraepithelial lesion. So we have to perform the colposcopy even in the pregnancy. It is not contraindicated. Please understand this statement. Colposcopy we can perform in pregnancy if it is needed. Like in this question, they have mentioned in this scenario that high grade squamous intraepithelial lesion. So we have to perform the colposcopy, and if it is needed then biopsy, and then further management plan accordingly. So correct answer is E. Let's read the explanation. Women with low-grade cytological lesion should be managed in the same way as for non-pregnant women with such lesion, with a repeat smear after 12 months. This is very important point. If women is having a low-grade squamous intraepithelial lesion, we can repeat smear even in pregnancy, but it should be repeated after 12 months. If that 12 month is coming during pregnancy stage, we can perform the smear because it is needed as per their protocol. If she has previously diagnosed low-grade squamous intraepithelial lesion, then we have to repeat smear after 12 months. So, with a high-grade squamous intraepithelial lesion, sin 2 and sin 3, the woman should be referred for colposcopy to see to decide the management, that either it is a invasive cancer or a pre-malignant lesion, and decide the management accordingly. Please, this statement is very important. Colposcopy is completely safe during pregnancy, and if it is indicated, we can perform colposcopy in any stage of the pregnancy. Please remember this point. And I hope this question is clear to you now. Thank you very much.